Belize is a developing world country in Central America. And for tourists, Belize is known as nature's best-kept secret. In the year 2000, the government of Belize committed to striving to complete the United Nations 8 Millennium Development Goals, which according to the United Nations Development Program website, the 8 Millennium Development Goals are a common set of goals and targets to bring all people up to minimum acceptable standards for human development by 2015. The first Millennium Development Goal is to eradicate extreme poverty and hunger. In Belize, the things they most struggle with in this particular Millennial Development Goal is the unemployment rates people have, which causes less income for food as a result. Crime in Belize is a serious problem, especially when it comes to their growing involvement in the Mexican and South American drug trade. Almost every day on the Belize Channel 7 news, there is a story about people getting caught trying to smuggle drugs. These people are Belizeans and foreigners alike. It would be a great step forward, not to mention a great blessing for Belize, if the drug trade ceased completely in their country. The second Millennium Development Goal is to achieve universal primary education. Belize has a pretty good system when it comes to primary school. There is a good literacy rate, although something that could be improved upon would be to fix the problem with the expensive costs of uniforms, books, supplies, and annual registration fees that are required for each student. Not all families in Belize have this money, and sometimes parents, instead of sending their kids to school, end up not sending their kids to school and keeping them at home to help the family work to make money and also clean around the house and other labor. If these prices were cheaper, at least then some more children, even if just a few, more children will be able to attend school in Belize. The third Millennium Development Goal is to promote gender equality and empower women. In this area, Belize is doing pretty good. In Belize, measures have been taken in order to improve the gender equality and empowerment of women. For example, women are allowed to vote and participate in government matters and discussions, and women can even be government delegates. The following video shows how well Belize is doing with this Millennium Development Goal.
free legal clinic was held today by the Women's Department in Belize City. The clinic, held at the IT Vet compound in Belize City, offered free legal advice to men and women. The event is in line with the 16 days of activism to end gender-based violence. Cynthia Williams of the Women's Department told us more.
Today we are having the legal clinic as part of 16 days of activism. It is an opportunity for the legal public to come and access free legal advice from different attorneys who have willingly offered of their time free of charge. So persons are able to come and ask questions on issues such as divorce, legal separation, child custody, maintenance, domestic violence, property rights. It's really open to whosoever who may have a case and who doesn't really understand what different processes they need to follow in any of the other in the issues that I know.
The department partnered with 10 attorneys who throughout the day provided the public with answers to their questions on child custody, maintenance, divorce, legal separation, and other family-based legal issues. One of the attorneys participating in the event spoke to us afterwards.
It's an individual interview. So each client comes in and we sit down one-on-one with that person and go through their problems and answer the questions that they pose and give the advice that we think is deserving. So far, the clients that have been coming in have a lot of questions on a wide range of the law. But the main issues are divorce, when you're having problems within your marriage, how properties are divided, what happens on the death of a partner, and domestic violence. Most instances, it still remains in Belize that the title, especially to the matrimonial home, is placed in the husband's name. But it still remains to a large extent that people assume that the person's name who is on a title has all the rights and entitlement to that property, and they have no rights. So it's our duty as attorneys to advise them that that is not the case, and the law is largely dependent on the contribution that a person has made to the acquisition of a property.
Today's legal fair is not the only initiative of the Women's Department to offer legal aid to citizens. However, Cynthia Williams explained that many times the Women's Department comes across people who need legal advice but are not able to afford it, and so the department tries to provide the service at least 3 times for the year.
We usually have these sessions not only during 16 days of activism but also during Women's Month, and at times we've also offered it during the year because we know of the need. People are not able to even afford a consultation with an attorney, and so we have people coming to us during the year coming for advice to the department. We are not lawyers we don't have any expertise in terms of the laws, and so what we also do when possible is we've developed relationship with certain attorneys, and whenever we can they are able to give us the advice over the phone, and that's why we are very happy that we are able to offer these services.
I apologize. Hold on one second.
At least 3 times a year, at different points.
While there were mostly women seeking legal advice, there were also a few men who took advantage of the free clinic today.
So in the course of this goal, I believe that it is going pretty well. The 4th Millennium Development Goal is to reduce child mortality, which, if we go to this chart, At this website, we can see that the mortality rate of children has gone down, as planned, and continues to go down. Belize is doing a good job of preventing child mortality. The 5th Millennium Development Goal is to improve maternal health. I would like to show you this following video that goes with this nicely.
Throughout the world, one woman dies during childbirth every 90 seconds, and the United States is actually seeing an increase in maternal mortality rates in recent decades. The World Health Organization reports that with a rate of 11 deaths per 100,000 pregnancies, the United States ranks behind 40 other countries. Some health officials say that this could be due to an increase in age of pregnant women, obesity, diabetes, and the number of C-sections and induced labors. In just California alone, the number of women who die during or after pregnancy has nearly tripled in just the past 10 years. Some experts say that many of these deaths could have been prevented. Meanwhile, in Belize, maternal mortality rates are said to be decreasing thanks to programs focused on educating women about the importance of proper maternal care. The country is improving the accessibility of healthcare for expecting mothers and making sure there are enough facilities, personnel, and tools readily available for these women. One of the biggest issues in Belize is that women are waiting until they're actually in labor before they even see a doctor for the first time. So educating these women on these issues is one of the key components in Belize's plan to reducing their maternal mortality rate. See you in late January as I head to Belize to begin my reporting on this critical issue.
As seen in the video, when it comes to improving maternal health, the most important thing that can be done in Belize is to educate the women about how to have maternal health and keep that maternal health. This process is taking place and progressing nicely in Belize. The 6th Millennium Development Goal is to combat HIV and AIDS, malaria, and other diseases. First off, I would like to show you a chart of with malaria's where malaria is common in Belize. All over Belize is a high risk of malaria, but the area of Belize that suffers most from malaria and is most prone to getting malaria is in the Sayo district and in Telendo district, especially where there are villages close to streams and rivers within about 2 kilometers. These dark blue dots are where the biggest problem with malaria is in Belize. You can see that there are many in the Sayo district and even more in the Toledo district. If we go to Google Maps and look at the Sayo district, we will notice many rivers. These small rivers close to the villages make the increased likelihood of mosquitoes carrying malaria more prone to their citizens, which is a problem. There are also more streams and mini streams and valleys around Toledo district as well. HIV and AIDS in Belize has been a big problem and continues to be a big problem. But Belize is making huge progress in reducing the cases of HIV and AIDS. The biggest help for fixing this problem in Belize, I believe, is increasing knowledge about HIV and AIDS. The following video shows the UNDP is helping reduce rates of HIV and AIDS.
I didn't really know much about HIV or AIDS. We only hear that AIDS was out there. And
I was diagnosed HIV positive on December
I
2000.
know that my partner is HIV positive. After I found out, I felt like, okay, I don't have a life anymore. Where do I start?
It was hard for me because I wouldn't believe I would ever catch it.
I said, wait, if this is positive, it means that I'm going to die from AIDS.
HIV is not just physical, it implies a lot of things. It's emotional.
I think about what people will say out there. And
It's
so
how you have to fight with society against the stigma and discrimination.
It is going to affect you so long as you put yourself in its spot.
Each one of these samples represents a patient. Unfortunately, there are still new HIV cases, positive reactive cases found every day. The blue color here represents our positive HIV results. After 16 tested, you can see that 6 of them are HIV positive.
Although it has the smallest population of any Central American country, Belize currently has one of the highest HIV prevalences in the region. Poverty, unemployment, chronic malnutrition, drug abuse, and violence are some of the factors that drive the HIV epidemic.
We feel that we have mostly a generalized epidemic, but we also know that there are certain pockets where we have higher incidence, and obviously we're very concerned about that. And so we are working to find ways to bring down that rate.
While there is much still to be done, in the past 5 years, the national AIDS response has had some success in reducing the spread of the disease.
As a country, I think we've moved out of an embryonic stage in the early 2000s when things were a little bit more haphazard. We were just trying to figure out how we would really approach in a systematic way this issue of HIV. And the last 5 years saw us leave that stage of perhaps confusion and enter a stage in which we tried to establish systems.
In 2010, the Global Fund approved a Round 9 HIV/AIDS grant for Belize to scale up the national AIDS response and to halt the spread of HIV. The grant focuses on bringing critical services to populations at higher risk of HIV infection, such as young people, female sex workers, and men who have sex with men. UNDP has been selected as the principal recipient of this grant.
I do see this partnership between Global Fund and UNDP as the best of both worlds. It's a perfect combination of very global knowledge with very concrete understanding of the challenges in the ground.
The National AIDS Strategic Plan in Belize is complemented by the objectives of the Round 9 grant. Working as the principal recipient, UNDP has identified and is working with 6 sub-recipients selected from government and local civil society organizations.
UNDP in Belize brings this forum for people to come together, respecting national commitment, national ownership.
It's very important that the National AIDS Commission has these high-level international partnerships because that brings in a level of expertise and technical assistance that we maybe couldn't get otherwise.
UNDP brings that experience from not only in other countries that are similar to our situations, but from around the world as an advisor, as a partner.
We also feel very confident that they can assist with technical training and other technical matters as we go along so that we can make the best possible use of the money that we are getting from Global Fund. We can then funnel that down to the groups who are working in Belize on the ground with the people that need that assistance.
What this partnership will do is to strengthen what we are already doing with these populations and expand our reach.
It's important that we do outreaches such as this satellite table that we do because you get a wider view of people that you wouldn't target on a daily basis. At this bus terminal you have people coming in from all over the country and they're passing through, and if it's even just one message they hear, that message might impact somebody's life.
UNDP can and should promote a meeting of ideas. Without this, I don't believe that an HIV problem will be solved.
There's many things that I can do that is very positive. So I'm not going to stay as if that's it for me, no.
We can stop HIV and AIDS from affecting our country, from destroying our country, if we can change our attitude, if we can change our behaviors.
I think about 10 years from now, I'm making plans for my life, for the future.
While there are many challenges ahead, by effectively addressing HIV and AIDS through the collaborative efforts of government, civil society organizations, UNDP, and the Global Fund, Belize can continue on the path to meaningful and sustainable development.
The seventh Millennial Development Goal is to ensure environmental sustainability. As I said before, Belize is also known as nature's best-kept secret. One of the amazing things in Belize is the remarkable geological phenomenon called the Blue Hole. It is 46 miles off the coast of Belize, and it contains amazing marine life and coral reef life, as well as the depth of the underwater cave plummeting to over 400 feet to the sea floor. There is very little pollution and use of greenhouse gases in Belize, which I believe contributes to its amazingly healthy environment. In this tourism video of Belize, tourism video for Belize, that I am about to show you, you can see the almost storybook-like amazing environment of Belize that seems to have adventure lurking around every corner. By simply taking a look at the animals that live in Belize, we can see how special and important the environment and sustainability is in Belize, and important to the rest of the world as well. Over here is a natural forest reserve. The natural resources and exports that the people of Belize rely on are very dependent on the health of their environment for their productivity of the Belizean people. There is not a huge threat to the environment in Belize, but the most important thing to keep it healthy for the locals and the animals is for tourists of Belize that come to visit to not trashing the land or destroying the forests. As long as there are strict rules for how tourists can affect the environment in Belize, I believe Belize will be pretty well off with their environmental sustainability. The 8th and last Millennial Development Goal is to develop a global partnership for development. As I talk about this, we will zoom into one of the Belize's supreme courthouses in Belize City. According to the United Nations Development Report for Belize, they are making slow progress as it pertains to trade policy and development. This is a goal that definitely still needs some work in Belize. By gaining better global partnerships, Belize would better be able to sell and export their goods and be able to earn money for their people and their country, and possibly even get out of their critical debt. Overall, I would say that compared to other developing countries, Belize is doing pretty well at striving to achieve the most of the millennial Overall, I would say that compared to other developing countries, Belize is doing pretty well at striving to achieve most of the Millennial Development Goals as of 2011. Thank you for watching.